Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage. Today's presentation is titled Need Health Insurance? New savings are here at the Health Connector. We have a number of participants who have signed up, but we will go ahead and get started right now at 10 a.m. today as scheduled. Welcome everyone. I'm Shaitra Sanders from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues Nikki Conti and Melissa Montron, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion should last approximately 30 minutes. Then we'll have time for a question and answer period at the end. If you would like to ask a question at any time, please use the Q&A functionality button on your screen. We will be monitoring these questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others on the call are able to see what you may have written. If you have a specific personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local navigator. We are recording today's call. Following today's meeting, you'll receive an email with the presentation, along with a brief survey about the information we've shared. So there's no need to take detailed notes. Please complete the survey if possible, as we'd appreciate your feedback on today's session, and your input will help us develop future presentations. So without further ado, I would like to turn this over to my colleague, Nikki Conti.
Thanks so much, Shaitra, and thank you again, everyone, for joining us this morning. So Shaitra, if you want to go to the next slide, I just want to orient everyone to the information we'll be covering. To start us off, I'll cover an overview of the Massachusetts Health Connector and just give a little bit of background on the American Rescue Plan. And then my colleague, Melissa, is going to take you through just the practical steps of getting coverage through the Health Connector. As Shaitra mentioned, we'll provide you with information about getting help with this process overall. We'll have time for questions and answers. And also, we may be able to do a demo this morning. So we're very happy to show you a few things. With that, if you want to go on to the next slide, and if again, go to the next one beyond that, let's just start with what the Health Connector is. So for those of you who aren't familiar with us, we are the state's health insurance marketplace. So we are here for those who need health insurance coverage, whether you're an individual, family, small employer. We're trying to we have a platform that essentially provides affordable health insurance coverage for you. So you might be wondering, okay, well, what does that really mean? Who gets coverage through the state's Health Connector? And it's basically people who don't have access to health insurance coverage from another type of source. So let's say they don't have access to health insurance coverage through their job, through a partner, a spouse, etc. So those are the folks that can apply. Now, a lot of people who do apply for help paying for coverage do get some assistance. And then it's really important for me to mention that in addition to health insurance, people can buy dental coverage through the state's Health Connector. So if we go on to the next slide, here, I just want to orient you to our plans, some of the structure. For those of you who are kind of new to health insurance or new to shopping for health insurance, I really just want to kind of ease your minds so that you understand that any plan sold through the state's Health Connector meets both state and federal standards for coverage. So you'll never need to worry about, if you've purchased coverage through the Health Connector, enrolled in health insurance coverage through the Health Connector in Massachusetts, you'll never need to worry that your plan doesn't meet our state requirements or that you'll face some sort of penalty if you've enrolled in our coverage. So you can know that all of the plans are known as qualified health and qualified dental plans. So you have the opportunity to choose from a variety of plans from leading health insurance carriers in Massachusetts. Now, I want to describe some of the programs or some of our offerings that are exclusive to those who get their coverage through the state's marketplace. So by shopping through the state's Health Connector, you can access health plans with premium tax credits. So people with incomes in a certain range could qualify for tax credits that reduce the cost of their monthly premiums. And also now with the American Rescue Plan, there are even more savings available for people. So I'll talk about that in a few moments. To the right, you see the Connector Care program. Now, people who are in lower income folks, I think something, I apologize. Shaitra, do you want me to go back a step? Because it seems like something went wrong with my audio. Okay, so I think
please, yes, about at least 30 seconds back, Nikki. Thanks.
All right, no worries. So folks, I tried to, I clicked something I probably should not have clicked, so apologize for that. So I just wanted to talk a little bit about the Connector Care plans, and let me know if you want me to go back and talk about health plans with APTCs. But the Connector Care plans are exclusive to the states, are exclusive to Massachusetts. And these are for people in lower income ranges who meet other eligibility requirements. And basically through these plans, people could qualify for low or no cost health insurance coverage. We also offer catastrophic plans, and those are available to those who are under 30 or with a hardship exemption, and then dental plans. So I mentioned that you can buy dental coverage, and that's for individuals, children, families, small employers, and that includes pediatric only plans and plans with lower or higher deductibles. And folks, I just want to confirm, Shaitra, did you hear the explanation about health plans with APTCs? Okay, I think she did. So we can go on to the American Rescue Plan. So when I was talking about the advanced premium tax credits, I mentioned that now there are new savings available. So the American Rescue Plan was signed into law in March of this year. So that was just a couple of months back. And essentially this makes financial help with health insurance available to many more people. So a lot of people who already get help paying for insurance through the Health Connector are now seeing even more assistance when they look at their monthly premium bill. And many people who did not qualify for help can now see lower monthly premiums. So for those of you who are on today's webinar, we're really happy to explain all of this to you and explain that you could in fact be eligible for more savings. So if you want to go on to the next slide. Here, I just want to show you some sample premium savings that are now available to people because of the American Rescue Plan. Now, you can see some variation here because basically the premiums that are available and the savings that are available are going to vary based on the age of the person who's applying and where they live. So let's just look at a couple of different examples here. So first, I'll start with a person from Worcester, a 50-year-old person who is making, let's say, approximately $44,660. In terms of eligibility, they could be eligible for a Health Connector plan with advanced premium tax credits. So right now, so before the American Rescue Plan, if their premium was $371.58, their new monthly premium would be $269.82. So basically an additional $100 of savings that they're able to take advantage of for the rest of the year. And now let's do a little bit more variation. Let's take a look at the 25-year-old in Great Barrington. So if this person is making just over $35,000, but they were uninsured and never applied for coverage. So if they had been insured, through us, they would have been Connector Care eligible. That's $133. Now, with the American Rescue Plan savings, that monthly premium for them is $116. So again, even at that age range, that person is seeing a savings of $16.75. So you can look at these examples, think about where you live in Massachusetts, your age, your family size, et cetera. And later on in the presentation, I'm going to do a quick demo and show you where you can go in and kind of find out what your savings might be. So going on to the next slide, I am actually going to, at this point, hand the rest of this presentation over to my colleague, Melissa, who's going to take you through the practical steps. So Melissa, I will turn myself off and hand this over to you.
Hi, good morning, everyone. So yes, I'm going to go over the overview of the Massachusetts Health Connector and who can apply. So you should apply if you live in Massachusetts, are a U.S. citizen, U.S. national, or are otherwise lawfully present in the U.S. and don't have health insurance. You should not apply if you are enrolled in Medicare, Mass Health, or Medicaid, or other public health coverage, are offered affordable comprehensive health insurance from an employer, or are in jail. So who can enroll? So open enrollment is a time when you can apply for the new coverage for the coming year, or renew your coverage or shop for a new plan. The Health Connector's open enrollment is usually from November 1st through January 23rd. It is currently extended through July 23rd. For all Health Connector plans, your health or dental coverage can start as early as the first day of the month or after you enroll. If you need coverage sooner, apply right away. You may find you qualify for Mass Health. Next slide. Okay. There are 3 ways that you can apply. The first is online at mahealthconnector.org. We also have the Spanish version, which is the mahealthconnector.org/ES/. The second way is by phone, and the third way is with the help of a partner community organization or health center. There is one application to find out if you qualify for health coverage through Health Connector, including help for paying for coverage or for coverage through Mass Health. You will get letters from the Health Connector and Mass Health that tell you what your next steps are. And what you need to apply. So what you would need is your Social Security numbers for everyone applying if they have one. Immigration documents for all non-US citizens who are applying if they have one. And you can learn about those documents in the immigration documents section. Your recent pay information, if you have it, such as copies of your last 2 pay stubs, your unemployment amounts, monetary determination if you're collecting unemployment, information about your current income. If you don't have all the information above, just give us what you have and we'll send you a letter asking for more information if we need it. So the application for individuals and families. So again, to apply online, please visit the mahealthconnector.org. And if you do need the Spanish version, again, it's the mahealthconnector.org/ES/. One application for the Health Connector, Help Paying, and Mass Health. So this is a picture here of what the page would look like, and circled here is what you would need to click on in order to begin the online application. So how do you enter income if you're unemployed? When you complete an application, you'll be asked, you'll be asked about your current income and your estimated income for the year. So you enter your current income as it is now, including unemployment income. Then enter your expected yearly income based on what you think you'll make over the course of the year. When entering your yearly income, please consider how much you earned so far this year. Add any unemployment, including any extra dollars per week you may be receiving. If you think you will be returning to work later this year, include what might be earned. And if your income changes later, update your income information so it is as correct as possible. Keep your income and application up to date. Remember to update your income if your employment situation changes. Keeping your income information as accurate as possible helps make sure you get the right amount of help paying for health and dental insurance, have a lower risk of owing money to the IRS when you file taxes next year. And if you get advanced premium tax credit, which are the APTC, you can always adjust the amount you take by clicking on the Change Tax Credit link from the Find a Health Plan page of your application. If you adjust the slider tool to take less APTC, your monthly premium would be higher, but you might owe less to the IRS when you file your taxes. So getting help for paying. So there are two kinds of help paying through the Health Connector. So the first one is the Advanced Premium Tax Credits, which is the APTC, which lowers the premium amount you pay each month. The IRS sends your tax credit directly to your insurance company, so you'll pay less each month. You can apply some or all your tax credit to your monthly premium payment. The Connector Care Program. So this uses federal advanced premium tax credits, the APTC, plus Massachusetts state funds that help reduce the premium amount you pay each month. Has lower monthly premiums, low out-of-pocket costs, and no deductibles. Depending on the plan type you qualify for, you could choose a plan for as low as $0 or up to $133 per month. And we'll look at the slides at the end of this presentation. What are the income guidelines to get help for, to get help for paying for coverage from the Health Connector? So basically here we see the household size and the what you would qualify for state and federal help and the APTC. So the American Rescue Plan removes income limits for APTC help with premiums. By May 2021, people with income greater than 400% FPL may qualify for APTC. Instead of an income limit, people will qualify for APTC based on affordability. APTC will be available to lower the monthly cost of health plans, so they are not more than 8.5% of people's income. So choosing a plan and enrolling. Once you know what you qualify for, your next step is to shop for a plan. The Health Connector has tools where you can enter your provider and medication preferences to find plans and pricing. Before applying, you can compare plans based on provider and medication preferences using the plan comparison tool, find pricing from leading Massachusetts insurance companies with the Preview Plans button on the application homepage. And those who qualify for Connector Care won't see cost savings displayed from this tool. So from your online application, you enter your preferred providers and facilities and your prescription drugs compared to your plan choices. So we basically show you a picture here of where that would be. So you just click on, yes, I want help finding a plan and my preferred providers and facilities. So your preferences are included as part of your search results on the Find a Health Plan page. You can also filter and sort your results further. And here we also give another example of where you can find each one. So they're both circled. If you're required to make a payment, it must be received by the 23rd of the month before enrollment is considered complete. Submit your online payment by clicking Make a Payment on the My Enrollments page. And here again, we have another picture showing where that Make a Payment is in the Enrollments tab. So customer service and community partners. Where can you get help enrolling in health insurance coverage? So free enrollment assistance is available through the Health Connector customer service and across Massachusetts through community partner organizations. And here's some important contact information. So for the customer service, our number is 877-MA-ENROLL, which is the 877-623-6765. And also it goes on to explain for the TTY, it's 877-623-7773 for people who are deaf, hard of hearing, or speech disabled. For information about hours, days of operation, and more, go to the Health Connector Customer Service Call Center. Also, we have community partners, trained and certified navigators and certified application counselors who speak many languages can help you from application through enrollment into health insurance plans. They can also answer questions about eligibility, the application, payments, plan details, and healthcare reform rules and requirements. It is also recommended that you call ahead to schedule an appointment for help. To help find help in your language, go to Get Free Help near you. So reminders and details about shopping and enrollment. So losing your employer coverage is considered a qualifying event, giving you a special enrollment period for enrolling through the Health Connector. Be sure to apply and compare your options through the Health Connector within 60 days of losing your employer coverage. You can apply for coverage online or go by phone with the help of an assister. Some people will get an automatic special enrollment period to shop and enroll right away. If you apply online and cannot shop for a plan, call Health Connector customer service for help. You need to apply, enroll, and pay for your first premium by the 23rd of the month before your coverage can start. So for example, if you enroll and pay by June 23rd, your coverage will start on July 1st. You can also choose to have your coverage start on the second month after you enroll. You can get free help applying and choosing a plan through the Health Connector's customer service and across Massachusetts through community partner organizations. Call today to make an appointment for help. And now we are at the questions segment.
Thanks so much, Melissa. And actually, before we go to the question segment, I was just I'm going to take this moment, an opportunity here to show everybody a little walkthrough of a brand new tool that we have. So Melissa went through all the practical steps that you need to know about in terms of applying for coverage, the application information you need, etc. But we know that this is a process, and this could be a process that's really new for all of you. So before you do this, you might wonder, all right, what kind of coverage could I be eligible for? And what kind of savings could I get? So I'm actually at our landing page, the Health Connector's website, mahealthconnector.org. And I'm going to just click on the area that says Get an Estimate. So when I click on that link, I'm going to be brought to a brand new tool that has been developed. Now, our team put this together very specifically to help display what the American Rescue Plan savings are for folks. So with this Get an Estimate tool, you just need to enter a couple of pieces of information and we can find out what kind of coverage is available. So here I'm selecting coverage year 2021. I've entered a zip code and I'm going to choose an income level of $45,000. And I'm going to say that I have a household of 2. And I will say that one member of the household is 45, another member of the household is 33. And you'll also notice to the right, you can check off certain boxes. So if any one of these people is pregnant, disabled, or blind, you can check those boxes. And this does a little bit of a pre-screening. Again, please note that everything that we're showing you really are simply estimates. And it's really our opportunity to do a quick check to see if we can help lower your health insurance costs. So depending on what we see here, this might help drive you to come back to us and complete a full application. And then you can find out if you and your family qualify for connector care, advanced premium tax credits, or mass health coverage. So again, without further ado, I'm going to click on the continue button. And remember, I said we had a couple that was 45 and 33. And it's looking like, based on that income level, these 2 folks are eligible for connector care plans with advanced premium tax credits. And you'll see that up here that you could notice that you are seeing, or this couple is getting an estimate of saving $577 through advanced premium tax credits. So now I want to click on preview plans. And here you could see that there are, based on the zip code that I entered, these folks are eligible for a plan type, connector care plan type 3B. And you see the $577 for advanced premium tax credits. But on the left, you see the different health insurance carriers that are available. So Boston Medical Center Health Net Plan, Tufts Health Public Plans, and Always Health Partners. And on the far right, well, actually, you could read this from left to right. You see the very specific plan names, the coverage levels. I don't want people to get thrown off. I mean, you can see my mouse moving around here. I don't want you to be put off by the monthly premium, but rather I'd like you to know that's the true cost of that coverage. That is if you were not getting any savings, any associated savings. But here you can see the $577 advanced premium tax credit savings. Here, there are no state contributions at this level for this couple. However, they get to choose plans, let's see, $145.67 for the BMC plan, $170.67 for the Tufts plan, or if they wanted to go with Always Health Partners, they could, enroll in that coverage, and that would cost them $544.58 a month. So I'm hoping that this demo might help stir questions. And if it doesn't, actually, Shayitra, if you don't mind, if you want to take this back, we'll go back to the question section. Maybe we can, excellent, thank you so much. Maybe we can start off with a couple of questions, and that might stir some other questions for folks. How does that sound?
Sounds good to me. Thank you, Nikki. And I believe Melissa, if you'd like to come on screen also and assist with some of these questions. You guys must have done an absolutely great presentation, because there wasn't as many questions, but that's okay, because we do have some. And one of my favorite ones to talk about is COBRA. So we do have a question. If I have COBRA with American Rescue Plan subsidies, can I get health insurance through the Health Connector when those ARP COBRA subsidies end in September?
That's a really, really great question, Shayitra. And folks, one of the things we didn't specifically mention in this presentation, but we did include some more details. Shayitra, if you actually want to go through like a slide or two, move a slide or two up, we added some more detailed information here about the American Rescue Plan. And I believe if you go to the very next slide, we have some information on COBRA. So for people who are listening, who have heard about this, this is real. Through the American Rescue Plan, you can actually get help paying for COBRA payments. So essentially your cost is going to be $0, but that is only available from April through September of 2021. So Shaitra mentioned, the question was like, okay, well, what happens if I'm on COBRA now? Can I get on Health Connector coverage after that ends? And the answer is yes, you can. So if you've decided to take COBRA or you're thinking about taking COBRA right now while you can get these additional ARP dollars, yes, not to worry. When this ends in September, anyone who is in this situation is going to have a special enrollment period, and that will let you get into Health Connector coverage for October 1. So that is a really, really great question. I'm trying to think of, let's see, in addition to the COBRA question, Chaitra, do you have any others that you think folks might be interested in learning more about?
Yes,
Because
before we move forward, was there anything that you wanted to add on more about COBRA or enrolling in when they have COBRA or making the decision?
Well, you know what? That's actually good. Thank you for framing it that way. So right now, you might be weighing your options, right? So typically, people have said to me, "Oh, well, I always tell folks not to enroll in COBRA because COBRA might be too expensive for them." But this is a bit of a change, right? This is people, when you're thinking about enrolling in COBRA versus enrolling in Health Connector coverage, there are a couple of things you want to consider now. So someone might choose to stay in their COBRA, in the health plan that their employer offered them, pay for it, pay for that, get these through COBRA, get these American Rescue Plan dollars, et cetera. But know that these American Rescue Plan dollars are only applied to the premium. So that consumer, you would still be responsible for your regular cost sharing. Okay. Does that make okay? Regular cost sharing. I'm watching Shaitra. I'm seeing her nod. However, before you make that decision, you actually might want to apply through the Health Connector and check to see what other things you might be eligible and might be available to you. Because for some others, it might be more beneficial to just come in and enroll in a Health Connector plan. Let's say you're eligible for Connector Care. Your cost sharing for services is actually, or could be, much lower. So your copays for medications or doctor's visits could be even lower. So it's really something, I don't want to say, well, it's really a personal decision based on the person's circumstance, household size, if they have, depending on what their situation is, even with any kind of services that you might be utilizing right now. So I think I'm overall really just pleased to say that there are these options for people.
And you said to just come and take a look at your options. So pretty much you're saying you can come shop around and you don't have to commit to enrolling through the Health Connector. Am I correct?
Yes, thank you for saying that, because it is something when we talk about this, we usually try to explain to people. You can apply for coverage. You can sit down, go through the application. You're not committing to enrolling in coverage through the Health Connector. You are essentially just looking at your options, and you can look at your choices. We're not going to automatically enroll you in a Health Connector plan. So thank you for saying that.
No problem. And we have a question about unemployment insurance, if you or Melissa would like to answer this.
Sure.
If someone received unemployment insurance, what kind of plan could they be eligible for under the American Rescue Plan? And when would they actually be able to get that plan effective?
Yep. So in addition to the COBRA benefits that are available through the American Rescue Plan, there are also special benefits available for people who had unemployment insurance during 2021. So our team has worked really hard to implement these changes so that anyone who is either currently on unemployment assistance or even had it prior in 2021 can get access to these additional savings. So the rule is that if someone has or was on has or was collecting unemployment insurance, they could be eligible for a connector care plan that could be as low as $0 a month. So that is really, really, really exciting news. A lot of savings available to someone who is currently getting unemployment. Obviously, it's been the situation's been really interesting for people this last year plus. I was about to say year and a half, but the last year has been quite interesting. In terms of timing, though, we are in the process of implementing this right now. So over the last couple of weeks, anybody who had previously submitted an application with us we're looking at their eligibility again, and we're looking for anyone that told us they had unemployment income. So if any of you who are on this call are either helping people or you or a family member, you know that they already had coverage with us, you can expect, or they can expect to be receiving letters from us to ask them to look at their eligibility again, and they're going to need to take some action. Now, for people who are brand new, so let's say I'm looking at the participants, we have almost 30 people on right now. So if someone is newly applying for coverage, beginning this week, what's going to happen is at the end of each day, if someone had indicated that they have unemployment insurance, when you get to the end of the application, it will tell you to come back the next day and look at your eligibility, because the system is basically picking people up that have indicated that they have unemployment insurance and asking them to enroll in the plan based on that eligibility. So people can get this benefit as early as July 1. So I know I've done a lot of talking and a lot of explaining, Shaitra. So I just want to give Melissa an opportunity if there's anything that you'd want to add from your perspective, because I know you work very closely with members. So if there's anything more you'd want to acknowledge or share with folks from your perspective, that'd be great.
Okay, thank you so much, Nikki. I just want members to know, just to feel comfortable with updating the application. I know a lot of times I help people, they come on, but there's so many different factors and things changes going on as far as your income, whether or not you are returning back to work, or if you are still collecting the unemployment, but maybe you decided to return part-time, or whatever the case may be. Just continue to keep us updated, keep your application updated, just so that we make sure you're in the best plan possible and you're getting the best savings possible. So yeah.
Great. Thank you,
No,
Melissa.
that's great.
Thank you. And ladies, both of you, that was like the page where you can just sign in and continue with your application that Melissa was displaying earlier, right?
Yes, so great point, Shaitra. So when Melissa was going through the slide, she showed everybody, actually, if you want to go back to it, so we can just explain that for folks again. All right, great. So from mahealthconnector.org, we will show you the visual in a moment.
Yeah, just let me know where it is. Hold on.
We'll get there. We're almost there. So from
where is it? Hold on, guys. 1 second.
That's okay. We trust you.
Oh, there it is. There it is.
Thank you. Thank you.
Thank you.
So from mahealthconnector.org, so that's our main website. You can, in the upper right-hand corner, it's either log in or sign in. And basically, we're showing you the application page. And actually, as I say that, I believe there's the button that says Get an Estimate Tool, and then to the right of it, it says Apply Now. That brings you here. So Melissa showed you that when you're starting your application, this is where you begin. But I want to point out that after you have started an application, if you want to come back this is where you go to, and simply you go to sign in. So I guess it's worth mentioning, Shaitra, that if anybody had ever applied or started the application, didn't complete it before, they could just come back in, grab that application that they had started before, and then and complete it. And as Melissa was saying, you want to let us know if as things change in your life. So you really want to keep your income updated. Anything else that happens, you want your application to reflect that so that you're in the best coverage and getting the most savings that you can.
Well, thank you, ladies. Just to go back to something I recall hearing Melissa speak about, that we have the open enrollment has been extended. So the period that usually, I believe you said it ended usually on January 23rd, but if someone currently does not have health insurance at the moment, can they apply right now? And if they apply, let's say today or as soon as possible, how soon would they be able to get the coverage?
So I'm going to give this to Melissa to explain, because
Thank you.
I know she gets this question all the time.
All the time. So thank you so much. So yes, open enrollment this year ends July 23rd. It has been extended. So what that means is that throughout this extension time up until July 23rd, you can come on in and you can enroll with us, make changes, and basically pick out a plan that's best for you and your family. This is just the best time to do that. And let's see, what else, Shaitra? Basically just open enrollment, and what else?
So I think, so can I add?
Sure.
So, so now, as Melissa was saying, because it's OE, you don't need any special qualifying events, right?
Mm-hmm.
So
Yep.
it's a great time for you, great time to shop, as you said. It's kind of this like open door, if you will. So for whatever reason, if you didn't get enrolling coverage, it's okay. Just come on in and see what happens. And really, the reason it's been extended is really just a reflection of everything that's been going on with the pandemic. So it's really our way of just trying to keep the doors open so that consumers can gain access to health insurance coverage. So yeah, you'll hear about and hopefully see a lot from us about trying to get everyone to take action as soon as possible. Right now, today's date, I keep looking, I'm like, is it the 15th or the 16th?
The 15th.
Thank you. Right? You can still get coverage for July 1. So people can take action. If you take action now, you can apply, choose your plan. You need to do everything by the 23rd of the month, as Melissa had said, and you can still get coverage for July 1. But if you act in July, if you act before the July 23rd open enrollment deadline, you can get coverage beginning August 1. So I think that's our plug for open enrollment this year.
Yes, and you guys did say this open enrollment period does end July 23rd. So if a person who does not currently have health insurance right now, and unfortunately did not take advantage of the July 23rd, when would they have to wait for their next opportunity to apply for coverage if they do not have a qualifying life event?
So it really depends. I'm glad you asked that question because it really depends. So you heard us talk about the COBRA subsidies ending, being a qualifying life event. So, well, let me answer it simply, and then I'll do all the things that depend. So open enrollment is going to end July 23rd, and then we'll be going into a closed enrollment period. We won't be going into another open enrollment period until November 1. But that November 1 enrollment period is for January 1 coverage. So now I'll do my howevers. However, If you are currently taking up COBRA from an employer and then decide to drop COBRA because the American Rescue Plan savings are ending, you can apply for coverage through the Health Connector and qualify to enroll in coverage through the marketplace, because that's a qualifying life event. The end of those ARP savings is a qualifying life event. Also, if somebody applies for coverage and they newly qualify for connector care plans, they will also be able to enroll in connector care coverage. And then there are other things that happen in people's lives all the time that basically create qualifying events. So let's say somebody just moves here and they move here. And I don't think we have the link. We might have links. Are you going to the link to show people? No. Okay. If you go to
I
our
was
website.
attempting.
Well, I know we have links and much more information about this on our website. So please don't hesitate to check out mahealthconnector.org. We have a ton of information there for you. But there are all other types of qualifying life events. So if somebody moves to Massachusetts during the closed enrollment period, well, moving to Mass is a qualifying life event. If someone gets married, if someone has a baby or they adopt a child, these are qualifying life events that basically open the door to let people enroll.
Well, thank you for clearing that up. But yeah, let's all take advantage of the July 23rd deadline, ladies. Now, just to go back a little bit to what Melissa was saying, update your application if anything changes. So just for instance, if someone plans to change their job soon and they are aware that their income will change, what should they do with their application if their income is likely to change this year? When should they change it? Should they predict it, or should they change it when it does actually change?
Okay. Melissa, do you want to take this one?
Sure. I like to tell members that they should actually give us their current income as it is now. And then when there are changes, just actually go online into the application and make changes then. That's the best way to do it and the easiest way. So once the changes do occur, that's when you go in and make the changes, or give us a call and we can help you make the changes.
Thank you, Melissa.
Mm-hmm.
And now both of you ladies spoke a little bit about subsidies that are available through the Health Connector. And if a person thinks that they might not be eligible for subsidies, are there any other benefits of them actually applying through the Health Connector and obtaining their plan through the Health Connector?
Yes, thanks, Shaitra, for framing it that way. So let's just say you're in a different situation. You applied. There were no savings available, no American Rescue Plan savings available to you. You may still very well be interested in shopping through us. And one of the advantages I like to talk about really is all the comparison shopping that you can do. So I mentioned that you have access to leading carriers in Massachusetts. Availability is based on where you live. So, the carriers that are supporting your community, if you will. So I really would say one of the biggest benefits is just your ability to shop and compare. And we also, we've tried to create a number of online tools that can help you more easily choose from your options. So for example, within our application, as Melissa had showed you, you have the ability to enter your provider preferences. So if there is a very specific doctor that you want to make sure you retain a connection with, or there's a particular hospital or health center that you want to make sure that you can still continue to use, you can enter those preferences as you're going through the application, and then you can pick from the plans that have those options available to you. So I think from my perspective, those are some of the I think, real benefits of shopping through the state's Health Connector, which is our marketplace for coverage. Melissa, I don't know if there's anything you'd want to add to that, but that's from my vantage point. I think that's one great opportunity for consumers when they're comparing their options for getting coverage.
Definitely. I think that that was a great example. Yes, because a lot of times people have providers, they've been treating with them for years. They don't want to let them go. And so we have the tool to make sure that whatever plan you do select, that your provider's within that network and you don't have to change your doctor or, prescription or, anything like that. And a lot of times people think they don't qualify or for whatever reason. And I still, try to tell people definitely apply. You never know. Give it a try. See what your options are. Take a look at our plans and just get a better idea of what you're working with once you've submitted your application, what we have, because the savings are huge and the tools that we have to make sure you get the best plan, it's just great.
And Melissa, you just prompted something for me. And I think I want to make sure we talk a little bit about it, which is if you start to apply on your own and then you get stuck, right? Or you get to any point in the application, you're like, I just don't know what I should do. Or maybe you're someone that really just doesn't feel confident using a computer, using these online applications. And, these are really important decisions you're making. So you don't necessarily, maybe you don't want to go on it on your own. At any point in your process, you can call Health Connector's customer service, or you can contact one of our navigator organizations and make an appointment with somebody. All of this help is available to you for free. And wherever you were in the application process, they're able to log in and pick up wherever you left off so that you're not losing any time. They can essentially, if you got stuck somewhere, they can pick up from there and move you forward. Or if you need help updating something, folks can help do that for you and do that with you. So I just want to kind of hopefully give people a good sense of security that people are here to kind of help you get across that finish line.
And you said that assistance was free, right?
You got it. That help is free. So customer service, free, navigators, and there are also other people who can help, known as certified application counselors. And those are staff that typically work at hospitals and community health centers across the state. And some of the community health centers are actually our navigator grantees as well. So there's a combination of people, and I really feel comfortable saying that there's like over 1,000 people sprinkled across Massachusetts that can help with this process.
That's great to hear. And I know we've been talking a lot about the Health Connector and the connector plans and the subsidies. We do have a question about a Mass Health plan.
Sure.
If someone is currently on transitional medical assistance, TMA, through Mass Health, do you know when their coverage might change or when Mass Health would end for them? Also, does this depend on the official end of the national emergency?
Sure. So maybe it's worth mentioning that the Health Connector and Mass Health are two separate organizations, so two separate entities. However, we work really, really closely together. So when somebody applies for coverage on mahealthconnector.org, you might get an eligibility determination for Mass Health, or you might get an eligibility determination for Health Connector. Now, because of the pandemic, many people are enrolled in Mass Health coverage, and they are in a protected status. And you're right, Shaitra, they're protected through the end of the national health emergency. So that means they're going to stay in that Mass Health coverage until the national emergency ends. So I think this is really important today because, as I was listening to the radio this morning, I was reminded that the state's health emergency, that has been lifted as of today. We are out of the health emergency. I'm probably getting the exact terminology wrong, but however, mass health coverage is not ending until the national health emergency, until that is lifted. So once there is more information about an end date, you will be receiving, if anybody is a mass health member or anyone in your family is a mass health member, they'll be getting information from the state with explanation of next steps.
Thank you, Nikki. From my end, I don't believe we have any other questions unless someone has something last minute to add on. I definitely refer to our coworker behind there, our colleague Kayla, to see if there's any other questions. But in the meantime, we have a few more minutes. Nikki and Melissa, is there anything that you guys would like to end this with? Just a little bit of a takeaway for anyone who is still, needed of information here?
I know. So my mind, I keep thinking about our navigator. So I'll start from my perspective and then certainly hand it over to for Melissa and to add anything else. And I guess I just keep thinking about the great resources that are available to you across Massachusetts. Navigators can support people not only in their community, but because there are so many options now, as people are working remotely, doing things remotely, you can make an appointment with these folks and they can assist you. Some offices are reopening, some actually never closed. So you could get an in-person appointment if that's something you want. If you wanted and felt comfortable with a telephone appointment, they can do that for you. Or if you felt comfortable with Zoom, many are doing that as well. So I guess I really want to promote our navigators. And Melissa showed you, a variety of slides. Our slides have a lot of different links in them, and those links will take you directly to that area on our webpage where you can get more information. And when you're searching for a navigator organization to help you, know that you can enter a location. You can also consider any language preferences you might have. So somebody could help you in this process in a language other than English. So we have lots of different types of help available. So I'll pass Melissa the baton because I know I just gave you my navigator spiel or my navigator promotion, but maybe Melissa wants to add something else.
Well, being a navigator myself, I think that it's a great thing to have for members, especially when the whole entire process can seem overwhelming, or if you're stuck, or if you have a question, don't give up, give us a call. We want to make sure that you feel confident and secure in the decision you're making. This is a big decision. Your healthcare, and the costs and what goes into this. And yes, we have so many resources that can help you, but a lot of times people call me and I actually go through the entire process over the phone just to make you feel more comfortable. So if that's what you need to do, then definitely do it because that's what we're here for.
All right, great.
Nikki and Melissa, we've actually coming down to the final countdown to end this presentation. We do not have any more questions. I think you both gave a very detailed, great presentation, and to everyone who joined us today and came on to find out about these great resources at the Health Connector, I want to thank you for joining us. And just to remind you, this has been recorded and will be available to review after this meeting has ended. So Nikki and Melissa, thank you very much. And to everyone who joined us, thank you.
Thank you, Shayitra. Thanks, everyone.
So much.